The Honourable Member for Halifax. Mr. Speaker, according to a new report, 30% of people aged over 50 who go to private clinics must pay for colonoscopy services. Forcing people to pay for services that are to prevent cancer is against the Canada Health Act. Mr. Speaker, the federal government has the responsibility to protect the Canada Health Act. What measures will it take to rectify this situation? The Honourable Parliamentary Secretary.
Thank you very much, Mr. Speaker. As the member knows, our government is committed to a universal and public health care system. We support the law of the land, the Canada Health Act. That's why we have increased transfers to provinces and territories by more than 30% since we formed government, so that they can continue to meet the healthcare needs of their residents. We have also invested significant project funding to communities across Canada. Thank you very much, Mr. Speaker.
The Honourable Member for Halifax.
Mr. Speaker, each year the federal government receives reports on health service delivery from the provinces, but this government has repeatedly turned a blind eye to infractions and blatantly missing information. The federal government does not insist that the provinces comply with reporting rules. Vital information is left out, meaning that Canadians are left in the dark as to how funds are being spent, and the Auditor General has expressed concerns in the past over lack of transparency and accountability. We know that infractions are occurring. Will the government ensure that provincial reports accurately reflect this, and will they enforce the Canada Health Act?
Honourable Parliamentary Secretary to the Minister of Health.
Thank you very much, Mr. Speaker, and I repeat, we do support the law of the land, the Canada Health Act. Charging patients for insured health services is not consistent with the Canada Health Act. Provinces and territories are responsible to ensure that the delivery of insured health care services are done in compliance with the Act. They have the responsibility to follow up on these accusations, and the Minister has asked her officials to assess these situations as they come up. Thank you.
The Honourable Member